Hello, I'm Jeanette Wider, and I am Managing Editor of Healthcare Innovation. I'm here with Matt Roberts today, who is Practice Leader for Healthcare of Juniper Networks. So why don't we begin for our audience that may not know who Juniper Network is, what role you play in healthcare, and could you provide a little bit of overview about the company?
Yeah, absolutely. For those of you that don't know who we are, we're roughly a $4.5 billion company focused strictly on networking and security solutions. We have a vast footprint of 9,000 employees that are located all around the world. We're in 43 different countries. For those that aren't familiar, we cut our teeth in the service provider industry. And so we've taken that same carrier grade mindset. So think high performance, think high availability. And we've approached the enterprise with that exact same mindset, which includes healthcare. And so our mission you'll hear about today is really to extend our AI capabilities, so artificial intelligence capabilities that exist across our wired, our wireless, and our security products, all across our portfolio. Okay? And that's going to help us hone in really on what we're maniacally focused on, is that's changing the user experience. Okay, that makes us what's completely different than 3 years ago. Healthcare, it's a top 3 vertical for us. We've grown double digits the past 4 years. We had a record revenue year in 2021. And, 5 out of the 10 largest US health systems leverage us now in some capacity. So whether it be switching, routing, or firewalls. And so one thing that I'll leave you with here real quick is that outside of the industry, when you see the likes of Amazon's, the Googles, CVS, Facebook's, Walmart's, many other Fortune 100 companies adopting your technologies, you're doing something right? And I think we're leading the way, and we're actually leapfrogging a lot of the competition.
Okay, so Juniper has been making the news lately, especially with Gartner. Is there anything in particular you'd like to highlight to our viewers today?
Yeah, actually, we had some big news last year, and so Gartner announced, excuse me, their latest Magic Quadrant, which include the wired and the wireless LAN. And so they placed us as the clear-cut leader. So we are, the Magic Quadrant, we are positioned furthest up and to the right in both the ability to execute and completeness of vision. It's a big step for us. So it's important. We were seen as a niche player back in 2018. So I made mention a few minutes ago that we look completely different. So we've now really leapfrogged the competition in a matter of just a couple of short years. And we at the company, we see this as an official validation that our focused mission, again, about driving automation and simplicity is happening, and we're driving differentiation into the industry.
Okay, would you mind sharing a couple of important healthcare trends we need to pay close attention to, specifically as it relates to infrastructure?
Sure. I think if we start here first, we're all, it's fair to say we've all been challenged by COVID, right? So I kind of have to start there. The pandemic has been, it's been stressful. There's been a lot of loss of life. It's a dark place. We've all got our own experiences, but, when times are tough, we also find ways to innovate. That's what we do. And so throughout the pandemic, what I'd say is that, many healthcare providers, especially the ones that we engage with and we're talking to, really discovered that the network should be what I'll call the more strategic asset to the organization, especially those that originally perceived it maybe a little bit differently. And so we're seeing the delivery models, they're continuing to shift, right? We're seeing more things go remote, telehealth is important. And these IT leaders have to really ensure to make sure this network can keep up with all the demands, right? So we can scale. Everything is threat filled today. So dare I say it, there's more cyber attacks than ever. It's very distributed. So it's a highly distributed environment now with people working from home. People may not come back into the office anymore. And it really starts with taking what I'll say is a holistic look, right, at the network from really this point forward. And so a healthy network, it puts the organization in a prime position to scale. You've got to be able to integrate technologies quickly. So interoperability has been a big word in healthcare for the last decade. And it's real, right? And so how do we pull this stuff together to drive better outcomes? And then also safeguard all the users, the applications, the devices that exist in these environments. But it also requires what I'll say is a deep level of visibility. And you've got to be able to understand what's happening at the user, what's happening at the device level. And that's an experience, right? Which is often lacking. So you're going to see through the conversation today, we'll talk about how we are changing the dynamics of networking.
Great. Well, that's a great segue into my next question. So, networking technology is often overlooked, or considered just plumbing, so to speak. How can healthcare providers think more strategically about the network?
Yeah, I like to use the analogy. Networks like the vascular system and the immune system of the human body, right? So if you don't have a healthy network, pardon me, your organization's at risk. It's the lifeblood of the healthcare enterprise. I'll just point and simple, right? We know that data is important, but that data's got to move from place to place, and that's the network that does it. So if I'm an IT leader today, I encourage my team to really kind of take a step back. Let's assess the situation. Let's understand, can our network, can our security posture put us in the driver's seat for the next decade, right? It's asking some of the simple questions, but also pausing to slow down just momentarily to look, to figure out, am I in a place, in a good place that I believe, again, we can bring more things on, we can secure the environment, and then we really step forward, right, to help our IT operators become more productive, as well as the clinicians, as well as the patients, right, who are reaping some of the benefits at the backside of this. And so, you look at the economics here, the hard and the soft costs. Have you been buying the same brand because that's all you know for the last 10 years, right? Does that limit your freedom of choice? Of course it does, right? So I've been in healthcare for 20 years, and I'm a big advocate for choice. And so I'm also a big advocate of, hey, the provider should be in a position to dictate their own strategy, opposed to a manufacturer actually telling you what you can and cannot do. So pausing, taking a step back and looking at a lot of this to make sure that it's in your best interest and you're actually building the best of breed environment that's going to propel you forward, right, for the next decade.
Okay. So my next question for you is, how can healthcare providers utilize artificial intelligence to improve networking operations and user experience while reducing costs?
Sure. Yeah, I think it's fair to say that the industry as a whole is starting to see more AI, probably more so on the clinical side than maybe the IT side. But as you look at this, the infrastructure that's supporting all those applications and the clinical side, it's got to be embracing AI as well, right? Or else we're actually going backwards. And so, just like improving detection and diagnosis of certain medical conditions, we now have this ability, right, and the power of providing a whole assortment of different tools to see what's happening on the network, all the way down again to that user and that device level, which really dictates the experience, because until you can get down to that level, you don't really know what's happening on that tablet or what's happening on that computer, right, that might be going over the WAN, the wide area network. And I get excited because, we're sitting here on the industry's literally richest data science toolkit. It includes a massive amount of telemetry data. And just because we have it doesn't make us necessarily special unless we really help our customers use it effectively, right? And that's where it gets really exciting. And so we use machine learning in our network virtual assistant, which we call Marvis, to help take that telemetry data, which I was just alluding to, and we translate those insights into actions for network operators. They become much more proactive rather than sitting idle waiting for issues to pop up. So, you look at this and you go, hey, how can we change and really improve reducing the mean time to resolution for the network team? Who's always blamed for performance related issues, right? It's the network team at the end of the day. So, I say this, right, just kind of chuckling a little bit, but it's reducing mean time to innocence, right, for a lot of the IT folks. And so legacy environments, when issues pop up, right, who typically gets the call? It's the help desk. Then there's a period of troubleshooting time that has to occur, right, where you likely have to contact a clinician. It could be a doctor, it could be a nurse, to recreate that issue. It's stressful, right? It's stressful for everybody. Nobody wants to do that. We should be treating patients. And it takes cycles, and it's not productive at all. Now you got to throw in the fact that a lot of these issues that do pop up that could be network related or application related, you're chasing ghosts, okay, where an issue may pop up and may disappear, and then it might reappear a few days later, right? And so it's a painstaking process that we've lived with it for years, right? Just because we've had to do that, and that's just what we did. But times are changing, right? So that's the good part about all this, is that we're moving out of reactive mode, just like we are with preventative medicine. And we're becoming way more proactive, dare I say it again, preventative, right, on the IT side. And that's where our platform really can help out immensely. It's built on a microservices cloud. What that does is it allows us to scale almost unlimitedly. And so we can provide over 150 different machine states for operators, allows us to perform what I'll say is real-time root cause analysis, right, which is very important to be able to look at issues. And we can detect all different types of things, such as bad cables, misconfigured ports, and the list goes on and on and on. And that's important because in healthcare, there's so many different headless IoT devices. Okay, so when I say headless, kind of wired IoT devices, entertainment systems, security cameras, MRI machines, refrigerators, freezers, right? You name it. Those devices aren't smart enough to call the help desk, right? They can't pick up the phone, they can't call home. And so when there's a connectivity issue, what happens? Well, you have to get in, you have to figure out what the heck's happened. Is that security camera offline, or is it MRI not functioning properly? And that takes a whole level of troubleshooting that we just talked about earlier, where somebody's reactively going after this. Now, when you look at this and you have all this visibility in the environment today, it's a whole different workflow process. And you're provided this information with a dashboard that you know what's happening within your environment at all times. And so, we asked about reducing costs because the economics is important too. What I'll say is that, one of the huge benefits that most of our providers see immediately right out of the gate is, support tickets. And so how do you cut those down? So when you can cut those down by 80-90% by using AI for Wi-Fi tickets, the network is actually working for you opposed to you having to work for the network and dig into it, right? And so we've also changed the dynamics in the way that you deploy networks. And so we've got a health system that's in the Southeast that's done a case study with us recently. They've noted over a 50% time savings plus installing our wireless solution. So, that's because our portal can help out. It can do a lot of different things around setting up the access point. I can do channel planning. It can do radio settings, you name it. And that's what keeps us excited, because we are changing the game here and seeing how we can break the status quo. A lot of the networking architectures haven't changed for, like I said, the last couple of decades. And we help our customers automate. We help them simplify. This stuff shouldn't be brain surgery. You shouldn't have to have 15 different credentials to try to operate a network, right? It's almost like what I like to say is set it and forget it mindset. And the more robustness that we can build into the network so you don't have to touch it, the better you're in, the better position, because human error tends to be the number one reason for downtime.
Right. I like that. Set it and forget it. I like it. It's good.
I think it was a rotisserie machine, right?
I'm not sure, but this brings me to my next question. So I've noticed that a lot of healthcare organizations are developing strategies around wayfinding, asset tracking, and engagement. Does Juniper technology play a critical role in these?
Yeah, it actually does. And surprisingly, a lot of people don't realize that we have some really cool technology that plays a role in exactly what you just said. I'll call it the world of engagement, right? So our access points are Swiss Army knives, so they can do multiple things. And so we're the only company in the industry that actually embeds what's called VBLE, or virtual Bluetooth low energy arrays. And so we have those in our access points. You're probably wondering, what exactly does that mean, right? And so when I say VBLE, some people just haven't looked at this technology yet. Well, it means you can take our platform. It's literally built for the world of IoT. Okay, so we're expecting everything to be digitized at some point in time, and we can integrate location-based services into it. And so that allows us to help our providers to deliver what I'll say is kind of a high-touch experience to patients, guests, to staff, without relying on overlay technologies. And you've heard probably the term RTLS systems, so real-time location systems. One of the largest U.S. health systems in the U.S. leans on us today for user engagement and just what we're talking about. And so they built this brand new campus down in Florida. It's over 65 acres. The main hospital was over 1.2 million square feet, and they built this beautiful facility. But as they realized, when patients were actually coming in, they were getting lost, right? And so they actually use the guest network and the access points to deliver a step-by-step, turn-by-turn, literal navigation experience once they arrive. So they're greeted as soon as they come in, they can get from point A to point Z. They've also taken advantage of location services to do some pretty unique things to drive kind of a consumer behavior, delivering coupons at certain times as people walk by the coffee shop. Perfect example. A lot of hospitals struggle to find medical assets, right? Let's be clear. So whether it's wheelchairs, vacuums, pumps, ventilators, now they're able to track a lot of that stuff directly out of the access point over Wi-Fi. And there's just so many different things that you can do now. What I'll also say is that safety is important here too, and every hospital has to elevate their safety profile, not only from an IT side, but physical security. And so they use IoT ports that one of our access points, and they integrated into the Stanley electronic door locking system. And why did they do that? They had patients who are flight risks, okay? And so Alzheimer's, PTSD, et cetera. These patients have Bluetooth wristbands, okay, that are tracked. And so when they come within a specific distance of the door locks. Now, if somebody credentialed is with them, say, so social worker, another clinician, and they need to go to another appointment, maybe they're going to go to the common area for a walk, and they need somebody credentialed to be with them, that credentialed worker's permissions can kick in and allows both individuals to actually walk out of the door, again, tracking where they are based on wristbands and VBLE technology. So a lot of really cool things that are happening. I like to, I like to call this art of possible, but actually turning into the art of reality. And so we couldn't do this stuff 5 to 10 years ago, right? And so it's really, really neat what we're able to do now through Wi-Fi and using holistic networking technologies.
Okay, so when we're talking about sort of advanced technologies, your company has some really cutting edge software-defined wide area network technology. Would you mind sharing how this is helping with healthcare organizations, and perhaps explain to our audience maybe just a little bit about software-defined wide area network for those that aren't familiar with the term?
Yeah, absolutely. Like we were talking about a little bit earlier, I think it's no secret healthcare continues to be distributed, right? More and more. Whether we're acquiring new organizations that are, we'll call them foreign networks or networks that weren't holistically part of our network, or we've got people working at home now more that may never return back again to the office. And so providers know firsthand how distance can impact performance and reliability, especially as it relates to the network, because it can underpin, let's say, a telehealth visit, right? Or an appointment where packet loss means the difference between a really, really good consult and a really bad consult, right? Or even a mediocre one where you got jitter and you can't see what you're doing. It's just a bad experience. And so, with what I'll say is complex cobbled together networks, because that's what they are that are out there today. Visibility is completely lacking. A real understanding is gone, looking down at that user, looking at the device and that application level. And to be fair, we've talked with a lot of large integrators out there. It's like finding a needle in the haystack sometimes, right? And I hate to use that analogy, it's overused, but it really is. It's hard to determine what's going on across the wide area network. And so we recently announced our full stack SD-WAN solution. So it's got a whole new level of intelligence. It helps providers really step back, look at this, the way they've done this holistically before, and they can deliver what it comes down to is a more secure, more connected experience across their entire community. So this is a tunnel-free architecture. It's cloud-based. It's built on a zero trust security model, and it changes the game to speed and scale. And then you can deploy literally new services in a matter of minutes. So it's really that fast. It also has the economics behind it too. And so when you start talking about tunnel-free architecture and cutting out the cost of MPLS networks, there is an economic factor behind it. If you get a little bit technical here and we look underneath the hood, what I'll also say is we use the term SSR, so Session Smart Router. This technology is fully session-based, and what that means is it's got fine-grained awareness down to that application layer. So we can eliminate or help providers eliminate quality killing latency, right? And so, better Zoom sessions, better telehealth sessions, better voice calls, that list goes on and on and on. Another kind of use case that we've done with very, 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 very large, one of the top 5, I think, largest health systems in the US. They've got hundreds of sites all across a couple of different regions. Out of the gate, they saw that visibility was one of the biggest things that they did not have historically, that they were, felt blessed with when they saw this. And so within a couple of days of deploying this technology, they came to the quick understanding that they had no idea around the number of services that were running across their wide area network 24 hours a day. In fact, they were running Windows 10 or Wudo backups, and it was impacting the WAN, and they were saturating all their circuits, which is a big deal because it's impacting performance across the entire WAN. They also found that many of their circuits were actually pegged and they were undersized. So that helped right size some of that and to figure out what their strategy should be, at least as they look at it holistically going forward. So we help them clean it up a lot, right, and focus on improving the performance of that device again and that application experience. There were some other things that they saw benefits out of when you look at radiology and you look at your remote radiologists retrieving images. There were things where the hourglass was spinning, right? To be fair, we helped really look at how that was performing and then figuring out better ways, again, to use the tunnel-free architecture to pass that stuff securely and much faster at a fraction of the cost that they've been doing historically. So.
That's all really interesting. So before we run out of time today, I have one more question for you. Can you please provide our audience with 2 or 3 things that sets Juniper apart from other manufacturers in the networking industry?
Yeah. So, what I'll say, and everybody who's listening, who's dealt with network infrastructure, it's easy to get into a Me Too conversation, right? To be fair, especially in an industry that hasn't seen massive amounts of what I'll call is transformation over the last 20 years. It's easy to talk speed and feeds or revert back to it. However, what I'll tell you, Jeanette, and what I'll tell the listeners here today is that our core architecture fundamentally is different from our competition. That makes us really, really unique. The microservices architecture that we talked a little bit about earlier, and the embedded AI and machine learning capabilities that we truly do have, it will simplify wired and wireless networks across the provider setting. We're seeing it. This allows us to really fine tune, right? So that IT avoids having a frustrated clinician, like we talked about, to recreate an issue. And that's important. That's game changing because typically that doesn't happen today. And then second, our company is proud to be probably one of the few companies where the data science team, so think again, what we're learning and gleaning off the network, is tied to the hip of the customer success team. Okay. And why is that important? It ensures that both and the two teams, right, feed off each other and they learn about what's happening and who's experiencing what. And that's how we're able to separate ourselves from really what I'll say is that AI marketing hype, right? And so when you heard the term cloud for many, many years, it meant a lot to a lot of different people. And it was such a hyped up word. AI is kind of in that category as well, but we are separating ourselves from that hype. And really what I'll say is the cherry on the top is that we've helped trailblaze a new reality, again, for the healthcare segment.
Great. This was a fascinating conversation. I want to thank you for taking the time to be here with us today, Matt.
Absolutely. Thank you for having me. I appreciate it.
Thanks. And that'll conclude our fireside chat.